Welcome to the deep dive. Today we're really getting into a complex topic, drug policy.
Yeah, it affects, well, pretty much everyone, directly or indirectly.
Exactly. We've gone through a stack of reports, research, trying to understand this shift,
Yeah,
moving away from the old war on drugs idea.
toward something more like a public health model.
Right. And our mission here is to pull out the key insights from this material, see what this change actually means for communities, because it really does matter, doesn't it?
It absolutely does. Health, safety, it's all interconnected. And the sources we looked at, they really build a strong case for why this pivot is happening. The old ways just weren't cutting it.
Okay, so let's unpack that pivot. Harm reduction seems to be the core concept. What is that, fundamentally, based on the sources?
Well, it's basically a practical public health strategy. The main idea isn't solely focused on stopping all drug use. It's more about minimizing the negative fallout, the harms associated with it.
Reducing the damage, essentially.
Precisely. And a key principle that comes through is really centering the experiences of people who use drugs.
Yeah.
Valuing their lives, meeting them where they are right now to improve health.
So less about judgment, more about immediate safety and health, and maybe opening doors to other services.
Exactly that. The sources give concrete examples, like naloxone, that instantly reverses opioid overdoses. That's literally saving lives right now.
Okay.
And then you have syringe services programs. They're huge for reducing HIV, hepatitis C, preventing those outbreaks.
Yeah.
And they often act as entry points for people to access other healthcare, maybe even treatment if they want it.
That makes sense. Very practical. Now, something else in the sources that made me pause was this idea about danger. We tend to think illegal means dangerous, legal means safe. Is that accurate?
Yeah, the research really pushes back on that. There are studies, like the one by Nutt et al., that actually rank drugs based on overall harm using scientific criteria.
What do they find?
Well, it's surprising. Legal substances, particularly alcohol, often rank higher in total harm to the user, and harm to others than quite a few illegal drugs.
Really? Alcohol causing more harm overall than some illicit drugs?
Yeah, when you factor in everything, health damage, dependency, accidents, crime, family impact, community costs, all of it. It shows that legal status is, well, it's kind of a poor guide to how risky a substance actually is.
That's a different perspective.
And speaking of risk, the illegality itself creates massive dangers. Fentanyl is the prime example right now.
Yeah.
It's unbelievably potent.
How potent are we talking?
The sources say as little as 2 milligrams can be lethal. And it's often mixed into other drugs without the user knowing. That lack of quality control, the unknown purity, that's a direct result of the illegal market. It adds a whole other layer of danger.
So the market itself is a risk factor. Okay, let's look at policy then. It's messy, right? You've got federal law conflicting with state law. Cannabis is the classic example. Federally, Schedule I, but legal medically or recreationally in many states.
Totally. It's a patchwork quilt of laws. And when states try things like decriminalization, well, the sources show it's complicated.
Like in Oregon, Measure 110.
Right. They decriminalized possession, but ran into big problems actually setting up the support services, the treatment connections that were supposed to go with it. There was a public backlash, and they've ended up rolling parts of it back, recriminalizing to some extent, though still trying to push towards treatment deflection.
So just changing the law wasn't enough.
Not on its own. You compare it to Portugal, which decriminalized years ago. They saw initial success, drops in overdose deaths, HIV rates went down. But the key thing the sources stress is that Portugal backed it up with massive, sustained investment in health services, social support, treatment access.
Okay. So the lesson isn't just decriminalize. It's decriminalize and invest heavily in the support systems.
That's the critical piece. Success really hinges on having that integrated support ready to go. Now, there's another narrative we should probably touch on.
Let me guess. The idea that drug users are driving up crime rates.
That's the one. The very common connection people make.
But what does the research actually say?
Well, the studies we looked at suggest a more nuanced picture. They find that crime rates, especially things like property crime, actually correlate much more strongly with economic factors.
Like what?
Like unemployment levels, poverty rates, income inequality. Those show a stronger link to crime than drug use itself does, except for crimes committed specifically to get money for drugs.
So economic hardship is a bigger driver than the drug use status itself.
The data points that way.
Yeah.
And the sources also note something important. Many people in the justice system who have substance use issues, they also come from these economically disadvantaged backgrounds.
It's all connected then. Poverty, lack of opportunity, substance use, crime. It's not just one thing causing another in a simple line.
Exactly. It suggests economic hardship is a really significant underlying factor, often getting simplified down to just a drug problem.
Okay, so if we try to pull all this together,
hmm
what are the main takeaways from this deep dive?
Well, first, drug policy is definitely shifting, moving towards public health, harm reduction based on evidence. Second, legal status. Not a reliable measure of a drug's actual danger. The illegal market structure itself, like with fentanyl, has huge risks.
Right. And policy changes need real support.
Absolutely. Things like decriminalization need serious, sustained investment in health and social services to work. And finally, that dominant idea about drugs driving crime. Research suggests economic factors, like poverty and inequality, are actually stronger drivers for many types of crime.
That really reframes the issue, doesn't it? Okay, based on all that, here's something for you, our listeners, to mull over.
A final thought.
Yeah. If the research strongly suggests that economic conditions are more closely tied to crime rates than drug use itself, should we maybe rethink where we put our efforts and our money? Instead of focusing primarily on punitive drug approaches, perhaps we should invest more in tackling poverty, inequality, creating opportunities. Could that be a more effective path to safer communities for everyone? Something to think about.